the voice of truth tells me a different story. I will choose to listen and believe the voice of truth.
So, welcome. So we got great message tonight, okay? It's on posture in the nervous system, all right? And so many times, everybody in here, what do you most often hear me tell you or say to you? And my wife lied. I'm going to ask a bunch of questions tonight. So, what's the number one thing I ask you all the time when you come in here?
How are you?
Okay, definitely. I do that for sure, right? Yes, ma'am.
Have you been doing your traction?
That's definitely true, right? Have you been doing your traction? Amen to that. What's the other thing I ask you?
How's your breathing?
How's your breathing, right? And why do I do that? Why do I ask you those questions? Yeah, right? That's all part of your results. So we know chemical, physical, emotional stresses all add in for us to be where we are, not only from a curve standpoint, but from a life standpoint. So last month, we talked about all sorts of different stuff, right? We talked about the microbiome, how that influences your physiology. If you've tuned into the health hacks, every week at 3 p.m., Monday on Facebook, we're having health hacks come out. The one we did this week is on belief systems. So tune into that. It's at Health From Within, CA, on Facebook. That's just a 10-minute thing to bless you, bless your family, bless people that you know, people you care about, church members, all that. Which, by the way, if you're here with a guest tonight, pat yourself on the back, right? Because who gets the best results? It's the people coming to these things, but it's also those that are sharing what we do, sharing the mission, right? My alma mater, Life University, talked about to give, to do, to love, to serve out of a sense of abundance, expecting nothing in return. And we do that, what does that do? It opens our heart space, right? That's the emotional part of what we do. Tonight we're going to talk about the physical component of what we do, all right? We know that the adjustment does what? What do you guys think the adjustment does? Is it just like, oh, a crack? It cracked me right here, doc. It's right here. No, it's never there. I always tell you guys that, you silly rascals. It's never where you feel it, right? It's never where you feel it. Is that really where the problem is? It's not where the problem is. Come on now, guys. It's always, every time we adjust you, we're tapping into your nervous system. So you guys think I'm trying to play footsie with you when I'm touching your feet, right? I do see a lot of different types of feet, some different looking toes and, heels and all that. But why am I looking at your feet? I'm looking at your feet because your feet tells me what's going on up here in your head. Your feet actually do something called afferent, efferent input. There's a part of your spinal cord, and I'm going to get the Scooby-Doo look in a minute, called the dorsal column of your spinal cord. Okay? So all that is a fancy, your spinal cord, if you've ever seen a picture of it, like a cross-section, kind of looks like a weird mushroom, right? It's like, actually, I'll draw you a picture. Sometimes I forget this thing's up here. Let's see here. That's not a bad example at all, actually. And you guys, pardon me, you know how great of an artist I am. Stay back there. So, this is a cross section. What does that mean? That means if we take your brain out, that's your spinal cord looking straight in it, straight down. Take the brain out, we're looking straight at it. We've got the bones that surround it, of course, right? And inside is the spinal cord. So this beautiful, very complicated black circle up here is the hard bones, okay? Now in the middle, see if I can do this. Is this big enough, Jordan? Great. Okay. The dorsal column would be in this area right here. All right, that's the back. So this would be the front of your spine, like where your tummy is. Front. Everybody can see, I hope. This is anterior. If you can't, let me know. And this is the back. Posterior. Okay? That's the dorsal column. So that's a delivery system to where? Where's the dorsal column going to go? An area of your brain, the back of your brain, called your cerebellum. So after we adjust you, and during the process of adjusting you, we mess with your feet a bunch of times, don't we? And the reason why we're doing that is because if you've got a short leg, guess what it means? It means there's a subluxation, meaning that hard bone's moved out of place and it's crushing a nerve somewhere in your system. So you'll see us, we'll touch you and press here, and then we're checking your feet again. You're like, what is he doing? what is going on? He touched my ear, he's touching my neck, and then he goes back to my feet, and then back here and there. What are we doing when we do that? Well, we're challenging that area of the body. And so when we check your feet and the leg is short, when we challenge, like if I swipe your leg or I swipe up here by the brainstem, if it goes even, if the legs go even, then the afferent or efferent input, which is just a fancy way of saying the afferent is when the delivery system of that message goes to the brain, and then the efferent part of that message is when it goes away from the brain and you actually physically do the action. Everybody get that? So the afferent would be, okay, I'm telling my brain to move my arm. The efferent is, I just moved my arm. Everybody tracking? So when we adjust you, we're affecting afferent and efferent input. What are we doing to your discs when we adjust you? Yeah, we're opening your discs, absolutely. So all the orthopedic surgeons that said, oh, you got to have surgery, you're doomed, put you in false evidence appearing real or fear, you're going to die, right? All that stuff that you hear, right? It's not true. The power that made the body heals the body. Are there limitations to matter? Absolutely. Are they as often as we might hear an orthopedic surgeon say? I mean, what do surgeons do, guys? And what do they make off that? Anywhere between what? 100 and 200, not dollars, 100,000, right? In a lot of cases. So when we adjust you, we're putting that bone in the right place, taking pressure off that nerve, allowing those discs to get space. And now what happens when we do traction?
It holds it in place?
Yeah. It holds it in place, but also more importantly, what it does is it starts to retrain. Starts to retrain. So like, you know, many of you that are sleeping on your back with pillows under your knees, no pillow under your neck or head, that's retraining and neurologically training the adjustment that we've just done. So when we put that force in, constantly doing that, and some of you are like, after 2 days, you're like, Doc, I don't know why it's not changing. You know, for 70 or 80 years, I was destroying my spine, and, you know, I always brushed my teeth every day, but I can't figure out why 2 days we can't get past 80 years. Just doesn't make a lot of sense. What's going on here, Doc? It takes time and repetition. Every process requires time. So when we talk about posture, we have to talk about the adjustment first, because many of you are thinking and you're wondering, why have I not taught you stretch and stuff? Why have we not done the stretch and stuff earlier? Why do I harp on, traction so much? So every time that we adjust you, that's going to set that spine and that nervous system in motion. Every time we sleep on our back with pillows under our knees, that's going to set in that curve. And every time we do traction, that's another level of that. Now, what do you think are some of the things that cause this degeneration in the first place? What's the number one thing we always talk about? What's the number one severe, horrific thing that happens to all of us? I mean, how many people are born at home? Yeah. And ladies, you know that better than we do, right? I'm like a hitchhiker compared to my wife. My wife's like the driver, right? I was like on the sidelines. You can do it. It's not that bad, right? Coaching her on. She's like, what are you talking about? Get out of my face. Dude, get away from me. Yeah, like screaming at me, all sorts. I saw a side of my wife I've never seen before, man. She is like tougher than any Marine. Tougher than any Marine. So we know that childbirth's really difficult because why? Are they waiting for the baby to come out easy and they're just like chilling? Everybody's in Bahama, what is it? Jimmy Bahama? Tommy Bahama? Yeah, Tommy Bahama shirts, right? Beach bum. They're all hanging out, having cocktails. No, they're waiting. They want that baby to come out as quick as possible. So what happens is they put 60 to 88 pounds of pressure pulling that cervical curve, right? And that's just on a C-section. It's 90 to 120 pounds of pressure on a vaginal birth. Do we fall a couple of times learning how to walk? What about playground injuries, bicycle injuries? And then all the car accidents that everybody here forgot about? Oh, I've never been into a car accident. I had somebody try to tell me that the other day. I'm like, you've never been in a car accident? No, never been in one. And I kept pressing her and just asking her questions. So like when you were pulling out of a space, somebody just didn't rub against you. Because you guys know me, I'm kind of annoying that way, right? I'll like keep asking the question in a different way. Because I know that the answer's there, right? The right answer's definitely there. So I kept kind of asking those questions and trying to follow up to see if even she had pulled out of the driveway or maybe backed out of a spot. And sure enough, like most Americans, she had. And you know, most of the injuries, according to all the whiplash research out there, occur less than 5 miles per hour. and between 6 to 12 miles per hour, that's where 60% of the injuries occur related to whiplash. And most of us don't realize, right? These whiplash injuries, we don't feel it for 2 years. That's what the research is showing. That's what the big stack of paper is, not just to make me look cool, right? 2 years after the whiplash event, what happens is that person starts feeling headaches. They start seeing degeneration maybe on an x-ray. They start maybe having disc issues where they have radiating pain. So you see how the culmination of these events, we got birth, either vaginal or C-section, right? And then on top of that vaginal, on top of that C-section, what else do we have?
They yank you and pull you out.
Yeah, right? And then what if you were vacuum extraction, or what if you were, let's say, forceps and all that? That'll do it too, right? Yeah, for sure. So now what about this? What about if I sit at a desk for like 9 hours and I just stare at the computer like this? And are the computers ever up here? No, they never are, right? And then do they always have like the perfect, like ergonomically friendly chair?
Well, they do have standing desks now.
They do have standing desks, thank goodness, right? But what do I see most of the time when we do these talks in the community, and we go to like Wells Fargo Bank or on Camp Pendleton or wherever we're going, Costco, all these places we go? They have the armrests all the way up here, right? So what are their arms doing? Their armrests are all the way up here. So what's their, their shoulders are like this, and then what's that doing to the head? Moving it that way, moving it forward. And now what do you think would add to that if you're a woman? What's going to add to that if you're a woman? Those magical things called heels? Those magical things called heels, right? And you guys don't just wear like a 1-inch heel, man. These are like 5-inch heels, right? And don't get me wrong, they make you look fabulous. They make you look fabulous. But what are they doing to the rest of your body? Destroying it. Yeah. Because you're supposed to have a curve, right? We talk about 31, 42, and 0, right? So we talk about a banana-shaped curve. And we talk about how that first bone's supposed to be at 31 degrees. So here's the curve in your neck, right? That's your blue banana. That's supposed to be at 42. Oops. Right? And then that first bone is supposed to be at 31. So that first bone or brainstem bone right here is supposed to be at 31 degrees. The curve in your neck is supposed to be at 42. Are you supposed to have a curve in your lumbars? Yeah. You're supposed to have a curve there. But some of you got like 3 curves. And why is that? What does texting do, guys? Yeah. Are you kidding me? So that's why I'll tell you, if you're sitting and you're sitting right in front of me, it's like killing me, right? I'm watching it and you're like this, and I just laid my hands on you, gave you my all, loved on you, all that stuff, and then you're like this. Some of you are feverishly doing it like you're fighting a video game or something. I'm like, what's going on over there, man? Is this Call of Duty or something? We're doing a video game or something? And then you got emotional stress on top of that. You got heels. And then do you think if a guy's like doing like, because everybody knows here, what's the only workout a guy knows how to do in the gym? Chest and what? Biceps. Right? Those are the only 2 workouts ever invented for a man. Right? So what does that do when he has those little chicken legs, like Chicken Little? What does that do to his neck and his traps? He can barely wipe his booty, right? He's on the toilet. He's like, what am I going to do, right? Yeah, right? I mean, totally. And so what's that doing to his head? Yeah, and even if he's wearing a big heel on boots, let's say, or cowboy boots, right? What's that doing to the hips? It's tilting the hips anterior. Everybody go like this. Take your hands and go like this, okay? Now, this is something we learned in school when we were working on our doctorate. This is your right hip. This is your left hip, okay? So you're marrying me, so your right is your right, and right? So my right is not your right, okay? So cool. Okay, everybody gets that. So this is your right hip, this is your left hip. Now your thumbs represent the back part of your hip. Your index fingers represent the anterior part of your hip. And I'm not going to get into technical names because I'll lose some people. But this is, I want you to just go like this. When you wear heels, that's what happens to your hips. Now, if I bring you forward like that, where's the rest of you going? No, it's going forward. Goofballs, right? But eventually, what's the body going to try to do? Get that head above like horizon level, right? So even though you're going to go forward, it's going to try to give you a curve somehow and try to get it back. That's why when you looked at your films, when you first got under care here, some of you might have had like angles that were like 15 or 20, let's say, out of 31 on the first bone. But then your forward posture was just like, as my brother-in-law would say, shot, right? Because he's from New York, right? Your forward head posture was totally shot. Totally forward to your shoulders. So that's why you see people like this, right? And they don't know, they don't think there's any other way except to be like sick and suffering, right? And is their health good? What is that forward head posture going to do? Does it create early onset dementia, Parkinson's, multiple sclerosis, cancer, Lou Gehrig's? Has it been linked to all these things they call white matter disorders? Absolutely. Definitely has. Why is that? Because that's a lack of cerebral spinal fluid in your brain. Where does that come from? Comes from this lower curve and this upper curve. They call it the craniosacral pump. So it's the rhythm between this and the curve here in the hips and the curve up here. So does it make sense that if somebody's leaning forward, what do you think? Should we get him checked and corrected and adjusted or put him on a walker? What's the walker going to do to him, guys? Treat the effect or get to the cause? Yeah, it's going to reinforce and make it what? Better or worse? Yeah, makes it worse. Irene Lopez, she's not here tonight, right? Because everybody knows how many people sign up for these things? Like 100 and like 30 show. 30 show, that's what always happens, right? Somebody's like probably watching the next episode of House of Cards right now. God bless them, right? God bless them. But still, this is more important. And you see a correlation between the people that come here and those that get the best results. So yeah, when we do that, it's like cutting a hose off. When those hips are forward, that curve is going to be non-existent. It's going to go forward. And Irene Lopez came in and she was on a walker. She had the hunchback, right? Like Quasimodo and everything, right? On the what do you call it? The walker. She's on the walker, and what do you think that's doing to her oxygen to her brain, or the arterial flow to her brain? Cutting off by 30%. So do you think if veins, arteries, and nerves run together, that's probably shutting down her immune system? Maybe preventing her blood pressure from being low, her cholesterol from being low, maybe giving her migraines and headaches? Could that lead to cancer and dysfunction and disease and organ malfunction? According to all the research, it could. So when we talk about connecting this brain and spinal cord, it's so important for us to also be physically aware. I always talk about emotional health because that's the X factor. We can control this, but you know what's sick? Many of you do some of the emotional stuff more than you do the physical stuff, right? And you're like, oh, okay, well, I'll do my breathing today, or I'll go pray, or I'll do my yoga, my downward dog, my backward cow, and that'll fix everything. But meanwhile, Doc, I only do my traction like 5% of the time. Like, what are you doing? That's crazy. Or, I'm sorry, I tried one time to sleep on my back with pillows under my knees. Didn't work for me, so I think it's impossible. Well, how long have you been sleeping for like 60 years? Oh, on my side? Well, you think it might take a little more time than one day? Well, maybe. Well, yeah, definitely, right? For sure, we got to try that more. Rome wasn't built in one day. So we know that the power that made the body heals the body. It comes from the brain, it goes down the spinal cord, and out over the nerves to every cell, tissue, and organ. Universally, that happens. That's where life flows. This is called a lifeline, folks. It's called a lifeline. So when we think of posture, we got to think about our sitting positions all the time. In your car, at work, at home even. Some of you have those lazy boys, right? Or you have those big executive-like chairs. And like your body, like you get in a chair and you can't even find you. You have to send out like a search party for you, right? Like where did you go? You're in the upholstery or the cushion somewhere, you know what I mean? We don't want chairs like that. A good chair, let me grab my chair here. Now, Dr. Williams, you guys tell me if you need me to scoot back a little bit or if you can follow me here. Dr. Williams is gonna get some wedge pillows. When he met Dr. Tanya, he was really attractive, and he had a roller bag, and he had a V-shaped cushion, and he was in scrubs after he'd worked on dead bodies. And I went up a flight of stairs with a cushion, a wedge pillow, ladies, and a roller bag. Oh yeah. Some guys get weights when they go up to a girl and do a tank top. I had a roller bag and a V-shaped cushion, a gray wedge pillow that you put under your butt, right? So, Eventually we're going to get those for all these chairs. Just haven't done it yet. So the ideal posture is we want a chair that has a back. Okay? Now I disagree with a lot of doctors and so-called experts out there that believe in that bouncy ball. Why do you think I might not agree with sitting on that ball for like 90 hours a day? There's no back support. What has your body been innately trained to do for the better part of 30, 40, 60 years of your life? And if you're a woman in here, I know you're only 25, so 25 years of your life, we'll say. What has it been trained to do?
Slouch.
Yeah, it's been trained to slouch. So if you get on that ball, what do you think is going to happen in a matter of seconds, minutes, hours, or days? You're going to slouch, and then what's going to start happening to those, what they call them is those erector spinae muscles, the muscles in the lower back. Are they going to be really friendly and happy, or are they going to start like clinching down? Yeah, they're going to start locking up, right? So I'm not a big proponent of the ball. Some people advocate the standing desks, and if I had my pick, I would say a standing desk would be best, okay? But having the ability to sit and stand is awesome, because we were made to be creatures that move. We're not designed to be sedentary creatures. We're just not, because you see the products of that, right? We have, I mean, the highest diabetes rate in the entire world. So you can see all the time why that's not good for our metabolism rates, and it's not good for our overall health. Definitely not good for the physical musculoskeletal health system, right? So when we talk about good chairs, I'm going to want a chair that has a small distance between the back of the chair and the front of the chair. Why is that important? Because if the distance was really long that was under our butt or our thighs, what do you think is going to happen to our knees and our lower back? Our hips are going to go back like this, right? Where do you think we want our hips if we want to be up on our butt bones? Forward or backward? Forward. Yeah. Does everybody get that? So if everybody takes your hands, it's going to look weird. Somebody will laugh about this when they see the video, but that's okay. I love it, right? Take your hands, squishy part of your booty. Everybody gets to touch their own booty for a second, right? Maybe you're happy with the results, maybe you aren't. I don't know. But so you touch right there, right? There's some hard bones right there, right? Now, doesn't it make more sense to be on those bones than to be slouched like this in a chair going into your lower back? Everybody knows the guy driving a Honda Accord with rims on it and an exhaust, even though the Honda Accord, the max speed is like 80 miles an hour or something, but he's got the exhaust to make it sound like Mario Andretti drives it, right? What do those guys usually do with the seats? All the way back, right? Is that a great sitting position for their musculoskeletal spine? Or even more than their musculoskeletal part of their spine, is that good for their immune system? Is that good to prevent disease? Is that good for cerebral spinal fluid to get to the brain? Who here thinks cerebral spinal fluid is important? Yeah, can you live without it? No. You're dead. Dead as a doornail, right? You gotta have it moving throughout your spine. So, does a kinked hose get water through better, or a hose that's free and open? Yeah, we want a free and open one. If we got a kink in it, everybody knows what it's like to have those 100-mile hoses that go throughout your house and your dog gets tangled in it and you get wrapped in it like those old phone cords, right? And pretty soon you're like, what? There's no water coming out and you're trying to figure out why, and it's wrapped around a tree stump. Anybody ever had that happen? And you can't find the hose because it's all around the house because you chose the furthest water spigot known to man, and now it's wrapped around like 10 things and you got to go find the kink, and it's an old hose, so it's kinking everywhere. We want the hose to be free and clear. So when we talk about the chairs, right, we want this distance right here to be really low. Now, why do you think I might be sitting on a pillow here for this demonstration? Can you guys catch this okay? I told Jordan nothing. He's so great. I just pulled the chair out like 5 minutes before I came out here, and Jordan's like moving stuff around, and he's like, we'll just go with it. So why do you think I'd want to sit on this pillow? What's this doing to my hips? Pulling them back or pulling them forward? Yeah. So now, if my hips are forward, what's going to be, am I more likely to go forward or stay back? Yeah. Now, if I had like armrests that were all high, am I going to look like a normal person or like Quasimodo? Quasimodo, right? So, no armrests. We want there to be a lot of space for the knees, and what I tell people is we want the hips to be above the knees. So I'm probably pretty good. Maybe another inch or so. So if I'm trying to undo 80 years of degeneration, and in addition to making my regularly scheduled appointments, Notice how I said my regularly scheduled appointments and making those consistently. Do you think it might be a good idea to watch how I'm sitting and alter that? Yeah. You're trying to redo 80 years of neurology, 80 years of telling your brain, or 60, however long you've been on the planet, that this is normal. So we have to constantly repattern that, guys. So that's why I'm constantly, did you do your traction, do your traction, do your traction. And I'm like, whenever somebody says, you never told me that about your traction, I always laugh. Because I'm like, has anybody ever heard me not talk about traction? At least one time in a week. And even if you don't hear me directly telling you, you hear it in the bay. I know you do. I'm always talking about it. But in addition to that, we have to correct that posture, don't we? We have to correct that posture. So important. So, where do you think we'd want to put the keyboard? If I don't want my shoulders to be up like Quasimodo, where do I want the keyboard?
Lower or level?
Like here?
I'm going to say lower. You know why? You know what I like the most? And there'll probably be some study that shows that it gives you some testicular or cervical tumor 10 years from now. Hopefully not. Cross my fingers. But if it's a Bluetooth or if it's a wireless keyboard, right? Which I would say, yeah, if it's a battery-powered keyboard, I think you're safe as far as the tumors go. But you want that on your lap because you want your arms, and I'll stand up for this one. When you're sitting down, we want your arms down here. See how relaxed my traps are? Traps are these muscles right here by the shoulders. If you're lost right now, I'll slow down, okay? Because this is really easy for me to talk about this stuff. So if you're like shot right now, as my brother-in-law says, and you're like totally confused, tell me and I'll repeat it or say it a different way, okay? Because you guys know I'm good at doing that, right? So you're going to have your arms nice and relaxed, right? We've got the wireless keyboard on your hips. You obviously wouldn't be this high, but I'm standing and crouching, okay? So don't be that literal with me, all right? You're down here, you're typing. Now, where do you think we want the keyboard? Where do you think we want the keyboard, Rich?
The monitor.
No. Monitor, I'm sorry, guys. Yeah, the monitor. You're like, he's just talking about the keyboard. Doggone it. Yeah.
I would guess so.
No, I want it up slightly. I want it up slightly, because why? I'm working on that, right? When I'm running, you know what I do? And they taught me in the Marine Corps to relax, but they didn't teach me to bring my curve back. People think I'm such an idiot, probably. So I'm looking up like this, and I'm not like running into stuff. I'm watching the road, right? But when I run, I'm relaxing my arms, my jaw, my whole body's relaxed. I'm conserving energy. It's one thing the Marine Corps taught me. And then I'm breathing. That's why we can run like deer, like 9 miles. My master sergeant used to always say, Willie. He was Polish. He'd call me Willie. He'd be like, Willie, what are we doing? Marines aren't supposed to run. What are we doing? We're running from the enemy? But what they taught me was how to relax my body. And what I figured out is, man, I'll just work on my curve while I'm running. And what do you think bringing the head back does to the airways? Opens them, of course, right? So doesn't it kind of make sense if we have sleep apnea and we have problems or we have sinus problems that if I bring your head forward to the shoulders, I'm going to increase that, not decrease that? I mean, Hilton and the Marriott Hotel and all these wonderful people, they have these huge pillows. I mean, these pillows are ginormous. I mean, I don't know if they're trying to use it for like a step stool or you can say, these things are enormous and they're never comfortable, are they? They're like rocks. Like, what am I supposed to do with this rock that has a white little piece of fabric on it, right? And I'm like 5'8" on a good day. So, you know, to have this huge pillow, I'm like, oh my goodness. Like some of these pillows are designed for Brad back there, right? So we really got to be careful of where our hands are. We got to be careful of where the monitor is. Now, what about our cars? Are most cars designed like perfectly for our posture? No. Horrible. Horrible. They're absolutely horrible. And what are they doing with the headrest right now? What's a big theme that's going on with the headrests? Yeah, it's a good point, Rich. I never thought of that. They're bringing them more forward to protect you from whiplash. But here's what I'm here to tell you. If you get the amount of G-forces related to that and velocity related to a car crash, I mean, come on, guys, right? And then they're doing you a favor, right? They bring it forward, and what do? This airbag that just comes and just destroys your face like a 300-pound boxer, right? Running at you. Crazy. So if I were designing the seat, right, I don't know why they didn't ask Dr. Williams when they designed all the cars in the United States, right? But we don't want it to be a bucket seat. So many of you that have the seats that are like this, and like my elbow would be where your booty is, right? And this is where your legs are. And obviously I'm exaggerating. But what do you think I want to do with this space right here? Yeah. So maybe I want to I could take a pillow, I could take some folded up bath towels, and I want to bring it up so that it starts to slope this way. So the hips are above the knees, because what's that going to do to the hips? Pull them forward or backward? Forward. So if they go forward, where's the curve going to go? Yeah, it's going to go back. Now, is that optimal in a car seat? No. Or is that going to become optimal? It's a better way of saying it. No, because they're going to have that headrest way far forward. And then they're going to have the armrest turned inward. So what does that do to your arms? You're like, you feel like a weird fish, right? You feel like this weird sardine. I don't know what a sardine feels like, but now I do, right? That's what you feel like. So we want to stuff the space in where our back is to bring our hips forward. And then we want to probably get like a little hand towel. Towels are really useful, okay? And they're not as nerdy as a wedge pillow. Like me, if you want to win major cool points with the chicks, get a wedge pillow. Or ladies, major points with the guys. And you can stuff them into a bag. So you think we would want to do this on a plane? Yeah. Cha, as Wayne and Gar say. Cha, right? We want to do that. We want to fill that space. We want to move those armrests out of the way, because we can't control, and ladies, is just a fact, can't control your breast size, right? It is what it is. Is that going to pull you forward more? Yeah. So if you've got like elaborate, I'm not joking, guys. I mean, I was joking a little bit, but I'm not joking also, right? Because if I have elaborate hair extensions, I wear heels, right? And I'm big chested, or extra hair, right? Isn't that going to pull me forward? So I have to tell some of my patients, I'm like, sweetie, we got to do something with this, because what do you think I'm finding when I look at their nervous system? It's all like tore up. It's all tore up. Because not only do they have the hips going this way, and did they have degeneration before they started coming here? Like everybody thinks it's like, well, doc, I was just pulling the weeds out of the garden and, it started then, right? That's when it happened. That dandelion, man, it's got a lot of force and velocity behind it. No, it wasn't the dandelion. It was 50 years of degeneration, and the dandelion, for whatever reason, set it off. So now what are the hips being forward? What is that doing? The hair extensions, big chested, or the guys that are like this, the boots, the heels, it's all adding up. Everybody see that? So we have to constantly repattern that. So we can't change the car seat, but what we can do, and some of you guys are going to think, you're going to feel like Poindexter a little bit. If you've been way back here, chilling and rambling like a gambler, right? You're going to want to move that up so your back's this way. All right? Now, if you've been back here, is that going to be an adjustment a little bit? Barry, is that going to be something you have to get used to? Barry had it back. He was back like a G or something, you know what I mean? Like this. And he's like, Doc, what are you doing, man? You're cramping my style. And I said, just relax. I might be cramping your style, but if we pull it forward, right, that's going to correct your nervous system. It's going to help these changes set in. And then what do we do? Sure enough, what do we do, Nyla and Barry? We pulled it up, didn't we? We pulled it up. Now, do you think it's going to go perfectly like this? Even if you got a Lexus or Beamer or whatever, and you, all the dials, and I got an Acura, right? So, I'm doing all of it. Is it going to fix it? No. Because they designed it this bucket way. I don't understand it. It's got to have something to do with the crashes when we flip over 90 times, because so many people get in those crashes, right? And we're preparing for that. But God bless them for doing that too, right? But what we have to do is we want to fill that space, make it like this, hips above the knees, get something for the lower back, because if you're going forward a lot because the headrest is pushing you forward, then if you put something in your lower back, what's that going to do? Arch your back a little bit. Now, do I want to do a hand towel or a bath towel on my lower back? Yeah, a hand towel, because I don't want it arching that much. Is anybody totally lost or confused? Okay, good. Now, the next thing we want to do is we got to be careful of how much we're lifting it up, because what if our head is touching the ceiling? Is that good? Oh, Dr. Williams told me to have my head exactly smashed up against the ceiling. And if you're Brad, it's a different story. You got to buy a Humvee or something. But Tyson Claybo that I used to work on, starting right guard for the Atlanta Falcons, this guy's 6'7" and 330, I think he was. He had an F-350 Ford. Anybody know trucks in here? You know how big an F-350 is, right? The biggest truck they make. He had the seat all the way back, and his head was still touching the roof. Is there any hope for him? No. He's shot, right? He's shot. We just have to do the best we can, right? Yeah, or a convertible, absolutely. So then we just got to be worried about him rolling and getting in one of those wrecks. So all we can do is the best we can do. When you know better, you do better. So what we're going to do is fill that space, get the hips above the knees, put that lower back support in, okay? And we want to be, I would say, roughly that much distance from the ceiling. At least that much distance from the ceiling, because we want to have that space there. I want the headrest on your head, so make sure that you have me inspect your position of your car seat, because I want to make sure it's safety compliant. You're not doing anything crazy. Some of you would jack the headrest all the way up and it'd get crazy, right? We don't want that. We want it to be sound, so in case we get in a wreck, we're protected, but we also want to make sure we're working on our curve too. Now, what if we have couches that are really, really, really low and forward? Am I telling you to get rid of your couch and go out and spend $5,000 on a couch or however much you spent? No. What I'm saying is it might be a better idea to consider laying down. If you're watching, hopefully you're just watching Netflix and you're not watching all this news that's out there. Whew, scary stuff, right? Because what's that going to do to the cortisol levels? Increase it, right? So I'm going to read you some stats because I don't want to miss these. These are good. And I looked them up. I just can't remember them all. Over 1 million Americans each year suffer a whiplash injury. 25% of whiplash victims suffer from chronic pain disabilities. 1/7 of whiplash victims report pain 3 years after their initial injury. So I was wrong. I had it off by a year. Sorry, guys. When we talk about any of this stuff, and I mentioned the degeneration, didn't I? Anybody ever heard of Wolff's Law? Wolff's Law just talks about how all this is possible. How's all this stuff degenerate? Because many of you, when you came in, you were like, how's that possible, Doc? Like, nobody's ever shown me this. Nobody's ever said anything about this. Like, I don't understand why this is happening. Why are you the only one talking about this? Right? Like, I heard guys like you are like quacks, and I thought they meant like ducks or something. No, we're not ducks. What are you talking about? Well, how come a medical doctor is not going to tell you about this? They don't know. Yeah. They don't know. They're not trained, and I agree, they've been indoctrinated. Are they like devil, like Satan? No, they're great people. Great people, well-intended people. Okay, well-intended people.
For the road of hell is paved with good intentions.
There you go, right? He said it, I didn't. Right? But great people, just a little misinformed and misguided. There's a time and a place to do that. I get my arm cut off, I want them to sew it back on. But I'm not going to them to prevent disease. So the reason they don't know about it is because they're not trained in it. A holistic chiropractor, in particular, a curve correction specialist, like what we do, is the only one that can properly diagnose this and deal with it. So we've got to release your nervous system, release the body's intelligence. And is it only a physical thing? Jennifer Cross, is it just a physical thing? No. You mind if I share some of your business? You guys can hear about it on Facebook, right? Because Jen's going to win that grill, man. She's won that grill. Some of you, that must have been like a crummy gift. I've only had like 2 people do it. Well, I think a grill's pretty cool, like an electric grill. Like, hey, you know, summer sizzling, got a little theme going for Patient Appreciation Day, right? $10 off, standard process, right? Some great stuff, right? And here's the big thing. When you share your results, what happens to your results? Do they decrease or increase? Yeah, they're going to increase, right? So Jennifer, she just kind of innately knew, not only with my buddy, Dr. Chris Zano, but also when she met my wife and I, that holistic corrective chiropractic care by a corrective curve specialist just kind of made sense. And she had multiple sclerosis, it's gone away. Diabetes, it's gone away. High blood pressure, it's gone away. And like, I can't even remember all the conditions. Hey, somebody get me Jen's testimonial in a second. Like what, 12 things? Am I exaggerating? Like 12 things, right? I'll read them to you in a second. Caden's scrambling back there. She's like, I didn't know he was going to ask for it. Right, here I am. I'm on camera now. Love you, Caden. Okay, so let's read here. Multiple sclerosis, hypertension, diabetes mellitus type 2, cholesterol, severe stress and anxiety, chronic sinusitis, menstrual discomfort, frequent urinary tract infections, lower back pain, frequent digestive systems, and insomnia. So is curve corrective care very different than your regular chiropractor? Oh, crack me, right? And you go in there and he's not looking neurologically. Why is he not looking neurologically for your body? Yeah, he doesn't know, right? Somebody came in here, they were at a doctor's report a week ago. They're like, oh, he told me that was impossible to correct that curve. And I'm like, you know why somebody says that? Because they don't know how to do it. That's why they say that, because they don't know how to correct it. They don't know how to fix it. Now, who's healing you, me or God? God. God's healing you. Every single time, all the time. Jennifer knows. She knows that God healed her. Who's the conduit? Me and my wife. That's all we are. But God is the healer in here. That's why it's called health from within. Had to get on that brief soapbox for a minute. So Wolff's Law, unequal stress on the front or back of the spine will cause a buildup of calcium degeneration and decay of the vertebra, spinal cord and nerves, as well as rotting of the soft tissues in the involved areas. Man, it sounds wonderful, doesn't it? No, that's what happens when you put pressure and stress. So numerous scientific studies have shown the loss of normal cervical lordosis, which is your arc of life, and that first bone at 31 degrees, does what? The lower the brain, right? It lowers the brain in the brainstem and causes it to be pulled down into the bony spinal canal, right? So when you lose that curve, what happens to that brain? Gets sucked down. As you're going forward, what happens? The pressure and gravity starts to pull it down. So it stretches. That's why all of Dr. Bragg's research shows, Dr. Alfred Bragg, a neurophysiologist from Harvard, he did all the research studies on this, found that it's going to stretch the spinal cord 5 to 7 centimeters, put a pathological tension on the cord, and disease pathology is imminent. So if this is going on, guys, are you always going to feel it? Are you going to feel that happening? No. Most of you, when you came in here, you're like, wow, how could it be that bad? And what I always say to you is, well, if you didn't brush your teeth for 50 years or 30 years or 40 years, what would your teeth look like? And everybody always laughs, right? But it's so true. Yeah, you'd be like Fraggle Rock, right? You'd have a tooth over here, snaggletooth. Yeah. Your spine's the same way. Your spine's the same exact way. Tension on vital cranial nerves that exit the brain to control automatic body functions like breathing, digestion, balance, and heart rate. So this is what forward head posture, a loss of 31 and 42 in the curve does. This is what I call it Quasimodo syndrome does. Stretching of the entire spinal cord and nervous system. Reduction in quality and quantity of the mental life impulses from the brain to the organs, muscles, tissues, joints, into the body. Flexion of the neck cuts off blood supply to the spinal cord and reduces oxygen by 30%. Wow. Now, what do you guys think about this new platform out here? Pretty cool, right? Some of you think it's like really like Star Trek, don't you? Why do we do that? Just because it looks cool? Well, that's one of the reasons, you know. I do like when things look cool. But what's the other reason? When it vibrates, what do you think it's doing based on what I said about your feet earlier and checking your feet? Do you think that's affecting the input to your spinal cord and your brain? Big time, right? Big time. Here's all the stuff it's doing. Triples the spinal corrective rehab exercise effectiveness. So triples your results in here. Now everybody's going to want to do traction in the office. No, you got your home unit now. You got to graduate, right? You got to crawl before you walk. If you want some special traction sessions, we can schedule that, right? You got to pay a little bit extra for that, just because it's one of those things. It's going to take time to set you up and all that stuff. Increase muscle power and strength. Increase tone and posture muscles. Increase bone density. Increase balance and flexibility. Weight loss acceleration, increased lymphatic drainage, decreased cortisol levels, increased secretion of serotonin and neuroepinephrine, less pain and soreness from exercise. Wow. So you mean I'm going to correct the brain chemicals in my brain, that stinking thinking that I have about my spouse or my life or whatever? Yeah, it's one of the things it's going to do, for sure. Now, why do you think it helps you lose weight? If you were doing CPR on somebody, again, what way would you want the curve to go? Yeah, you want it to go back to open the airway, right? So does anybody think that your metabolic cycle is primarily ran by oxygen? Yes or yes? Yeah, it's run by oxygen. So if I have a curve, does it make sense if that oxygen is increased by 30% that it's going to reduce my stress levels and increase the amount of weight I lose? Yes. Yeah. Some of you are going to try to be on the traction, or you're going to try to be on the Vibe plate like 9 times a day. No, I'm not saying that, right? You still got to do your other stuff, right? Still got to do your other stuff. Okay, what else we got here? Okay, last thing I want to discuss that I'm going to read from. There is no correlation between vehicle damage and outcome. So a lot of us think if the car rolls 3 times, that means that we're going to, that it's going to do something devastating to our curve. It's actually the exact opposite. 60% of the injuries, like I said before, right, are 6 to 12 miles per hour. So the slower it is, why do you think that the slower it is, the more severe impact it might have on your brain and your body? You have more time to react, actually, right, when you're rolling. Your body's already tense because the process has already started, so it puts kind of like a cocoon of protection around you. Gets you in that sympathetic state, releases those chemicals, locks down your body, all that stuff. But when you're going really slow, like maybe we're Facebooking or texting, we all are sick when it comes to that stuff, right? And I don't mean like we're sick, we have a disease. Maybe you do. But you're like Facebooking, right? You're Facebooking. Or you're texting or whatever, and you're not paying attention, putting on your tie, doing your makeup, and balancing the wheel with your thing, and then pulling out, and you run into something, right? Yeah. That's what happens. And that's when most of it occurs. And what happens? I was looking at it earlier. The neck goes back. And what happens to the brain? Does the brain have a seatbelt on it? You know, one of the best movies out there for you to get a real accurate, simple concept of what your brain's like? Anybody seen Concussion by Will Smith? See that movie. There's no seatbelt on your brain. It's an anatomical fact. That's not just Hollywood. Your brain is floating in fluid. So some of us think, oh, I don't know why I have a headache. Oh, it's just a headache. You know, it came on after the accident, but I think it was something I ate, or I didn't get enough sleep. No, you pulled out in this huge car going 12 miles an hour, which unless you're a really good sprinter, I don't know how fast you would have to, I don't know how that would work, right? But then velocity, anybody know what a car weighs? It's a bunch, right? It's a bunch now, right? And that hits you 6 to 12 miles per hour, and there's no seatbelt on your brain? You think that's going to create some migraines and headaches? And then what are you doing to help it? You're texting, right? You're doing all this crazy stuff. And then you got the stinking thinking going, and your posture in your car's like this, you're low riding, and then we're sitting at a dinner table, or most of you are curled up in this weird ball. You know, some of the ladies in here, you're at work, and I hear this all the time, and some of you are sitting on your leg. You're sitting on your leg, or you have your feet up on your chair, and you're like in these horrible positions. Horrible. And I'm like, how long will you stay in that? Oh, about 6 hours. That doesn't have a factor, does it? That doesn't affect anything, does it? You know, I'll never forget one of the first patients we had. Is this guy, and he, you know, it's so funny because I'm looking on his curve and I'm looking at his scan, looking at his films, his advanced biostructural digital x-rays, and I'm looking at his scan and I'm comparing. I'm like, something's off. This guy's had a lot of trauma. Something's going on. I don't know what it is because, you know, Atlas was over here. You know the weird view that I take it in between the mouth, and you guys are like, what's he trying to do? Look at my tonsils? Like, what's going on here? And I take it, and what it does is it shows me rotation around the first bone. Is the first bone important, guys? Yes. What does it run in your body? What's right there? It's your brainstem, right? It's your brainstem, right? If you take your index fingers, go into your earlobes, right? That is your brainstem right there. Right there, right under where your earrings are, ladies. Right there. That's where your brainstem is. When I get you to open your mouth and I go in there and I take that view or that snapshot or that picture, that's going to show me how much rotation there is around that first bone. If there's a lot of rotation, what do you think it's doing to the cerebral spinal fluid? Crushing it? Yeah. What do you think it's doing to the brainstem? Giving it a bunch of room or crushing it? Yeah. So when we check that and then we take that other view and we see the forward head posture, that tells us a lot, doesn't it? Tells us a lot. So I'm looking at this guy's films and his first bone's like this, tilted up. It ain't supposed to be like that. From the anterior view, it's all crooked, right? And then it's all pointed down from the side view. I'm like, we got some major issues here, right? He's like, oh, doc, nothing happened. You know, I just, normal life, everyday stuff, normal migraines. I love when I hear that. Normal migraines, no big deal. Just, I only go to the bathroom like twice a day, but it's cool. A little high blood pressure. I got my diabetes medication I'm taking for that. Medication? Yeah, just the normal diabetes medication. The normal medication? Like, I'm like, what are you talking about? I did that Scooby-Doo look to him. I'm like, what are you talking about? Normal medication? I don't even know what that is. I don't even know what it is to take normal medication. And I'm looking at him. I'm trying to figure it out. We keep going on. He comes first visit, second visit, fifth visit, eighth visit. And finally, I'm like, dude, there has to be something going on. It's like, no, there's nothing going on. Finally, on the ninth visit, he comes in. He's like, doc, I just thought about it. I thought about it the other day. There was a plane crash this one time when I was like 10 that I was in, a little crop duster, and the plane crashed. And that might have had something to do with it. You think that could have caused it? And I just smiled at him. I was like, no, that doesn't have any connection at all. And I laughed. I was like, what are you talking about, dude? Of course. Of course that affects it. Of course it does. So, to recap, we know our nervous system's the most important thing, right? So, how many people do you think are actually subluxated on this planet and need our help? Yeah, right? So we got to get people checked, guys. Because people don't listen to doctors anymore. They listen to you. They listen to people like Jennifer Cross, people putting up their Facebook reviews and their Yelp reviews and stuff like that. That's the way we combat this. That's the way we deal with it. Because many of you sitting here, you know I'm going to go non-invasive before I go invasive. I mean, that's what we've taught you in here. You've learned that your body's a self-healing, self-regulating organism that's designed inherently to be healthy and not sick. And if it's not healthy, there's got to be a cause. There's got to be a reason why. So we got to tell more people this. Because guys are the worst. Men, you're the worst. Women, when their body's breaking down, they'll do something about it. Most of the time, a reason why a man comes in here is because the wife is like, get in there. I'm tired of dealing with you. I'm tired of listening to you. Kicking him in the fanny, right? Get in there. Go in there. These people are nice. Go get checked. We got to get more people checked. And it's not hard, guys. You bring them to a class like this. We got the dinner talk we're doing. That's about to be at this great place in Encinitas starting next month. Doing all sorts of amazing things. Let's get these people checked, because how many nerves perceive pain in your body? Is it like a huge percentage? What do you guys think? No. Yeah, between 6 and 18%. God bless you, Caroline Dooley. Yeah, between 6 and 18%. Middle of the road, 10%, right? It's a very, very small percentage. So that means there's another 80, 90% that don't have pain receptors, depending on the research study that you look at. So if a hard bone's crushing a soft nerve, can somebody be dysfunctioning inside, not know it? Yeah. How many times do we see that? My friend Dave Weinstein, right? Passed away about 2 years ago in his sleep. We hear about that every day. My father-in-law goes in and gets checked, has a clean blood panel, everything's great. Medical doctors, oh, you're in good health, everything's great. We checked the blood panel, no disease present. How many years does it take for disease to show up in the blood? What do you guys think? Yeah, it takes 7 to 15 years for disease to show up in the blood. So you think we want to wait that long? I don't want to wait. Oh, let's wait till the 15th year when you get the disease, and then we'll help you. That's crazy. Let's check early. Well, how do we do that? Well, we're not going to wait till it shows up in the blood. Let's check your nervous system. Let's check your brain and spinal cord. Well, how do we do that? Well, we have this revolutionary technology that allows us to look into the system and check that. Okay? And what we do is, since the skin's the largest organ, we're going to run it from your brainstem all the way down your spinal cord. And wherever there's a blockage, color shows up. Now, is this going to 99.9% of the time correspond with your film? Absolutely. Where there's a color bar of red, is there going to be a hard bone crushing a soft nerve? Yeah. So our mission is to get everybody checked. What they do with it is their business, but at least I want them to know that there's a different way. Right? Gunnery Sergeant Dave Smith, been under care here 2 years. Massive, massive spinal trauma. Some of you might remember 5 years ago, there was it was all in the news. There was a Marine that got thrown off a motorcycle. He was hit by a drunk driver, and he had something happen to his head where his skull was ripped off his head. It's called internal decapitation. It's got less than a 1% survival rate. Didn't sever his spinal cord, but pulled his neck off his shoulders. Had to learn how to eat, write, read, the whole deal again. Got a great job at Northrop Grumman now as a defense contractor. Defense guy, I hope I'm saying it right. Fancy pants, doing stuff for the Department of Defense, right? Yeah. There you go. Okay, thanks. So that's what he's doing, but he had to learn how to do everything again. And before that, right, he was blessed with 3 tours in Iraq, won a Bronze Star for the United States Marine Corps in our country. That's 2 levels below the Congressional Medal of Honor, by the way. And you'll see this guy. Got kind of a goatee beard. Sometimes he's clean shaven. Wears a vest, Marine Corps, all over the place, including on his Harley that he still drives, which is awesome. I love that. Because he's not being fear-based, because he loves doing it, right? He loves doing it. So he gets thrown off, right? Has all this stuff going on, surgery, and they basically bolt him from C1 to C4. They fuse it with metal. He's got neuropathic pain in his lower back from the improvised explosive device that went into him in his 3rd tour at Iraq. And they've got him on 5 pain meds. This is before the accident. So on a daily basis, when he first started coming in here 2 years ago, he'd have radiating pain, right? So we all put our pants on, and our fabric probably felt good unless we're wearing a burlap sack or something, right? And we're like, oh man, it feels good on my skin, right? Enjoying ourselves as we shower. Meanwhile, Dave's in like excruciating 20 out of 10 pain. because it feels like somebody just poured kerosene on his legs. Feels like somebody stabbing him. And they put him on pain medications instead of getting to the cause of what was going on. So his problem just got worse and worse and worse. And finally, we met him at one of the community outreach events. And I told him, I said, brother, I'm not going to let you wait. I know we can help you. I said, I was in the Marine Corps for 4 years. I didn't see combat like you did, but I can't let you go away without getting you checked. I got to get you checked, man. I got to get your family checked. I'm going to get everybody checked. We're going to bless you with that. We're going to bless you with that opportunity. And that's what we do for everybody. So I blessed him with a $700 preloaded gift card, covered his exam, his consultation, his results. He paid this $40 administrative fee. We got him checked. Within a few months, he's off the medications, right? And after 2 years of him being under care, they told him that C5, C6, and C7 were going to turn into pancakes. It was going to create compression fractures, and they'd have to go back in from the front and staple that. If they staple it in the front, what's going to happen to his head? Is it going to go further back or forward? So what's that going to inevitably do to the rest of the spine? And how many more surgeries is he going to have? The efficacy of spinal surgery is less than 10%. So after you have one, it's only a matter of time before you have more. But even more important than the surgery, what would that have done to Dave's life flow? What would it have done to the intelligence from his brain to his body, through his spinal cord and to his organs? Would have shut it down. It would have crushed it. We got him checked. We got him off the medications. He just had his review, his group go over at the 1 year mark and 1.5 year mark. And what do you think happened to the discs? Are they shut down, or is there more? Is there growth in them? More space? More growth, more space. Because we got to the cause of what's going on. So if you have anything going on and you're a guest here and you haven't been checked, we're going to bless you with that opportunity tonight. It's my honor to do that. And guys, let's get out there in the community. Let's tell people about what we can do for them, how there's a better way, how there's a holistic way. If you haven't filled out one of these pink sheets, do it. It's real simple. You just put names and numbers of people you care about. We invite them to dinner on me. It's an organic dinner. We're not doing like Subway where Jared's there and 7-Eleven or any crazy like McDonald's or something. We don't do that toxic stuff, right? We're going to bless them with a great meal, and we're going to talk to them about their health for 30 minutes. No strings attached. Why is that? Because if I can reach one person there, it's worth the money I paid for that dinner to change their life and change their family's life. Because does it just stop there, or does it continue? Continues, guys. You know how many people there are in here with kids, and their kids' lives are being positively impacted because they made a decision to put their health first, and in turn put their kids' health first? That's what happens. Caroline Dooley's got her daughter in here. There's so many people, right? The Daniels have their kids in here, right? The Mendezes, there's so many people. Let's get these people checked. Whatever, the Roses now have their kids in there, right? I think we got another family too. Yep. Zygowitz has got their children. I mean, we got tons of kids in here now, right? Got a whole play section. Let's get people checked. Let's bless them. If you're not following us on Facebook yet, at Health From Within CA, we do a 10-minute health hack every week. You will be blessed by that. The new website's coming out August 1st. Got a lot of exciting stuff happening. You're going to see some new faces around here, right? It's going to be awesome. A lot of great stuff happening and in the works. The advanced healthcare classes will be on the website. I'll also have other ways of you getting them. Look out for the newsletters every 2 weeks. I think one's coming out in a couple of days. I can't keep track of my marketing person. She's amazing. Oh, did it come out today? See, I don't even know. That's great. I love when that happens. When did it come out? Oh, I got it already. Cool. Awesome. She's doing her job. I love that. She's fabulous, by the way. Brandy Daniels. The stretching protocol. Jordan and Bracy, this amazing man right here. We did like 10 hours of filming. I felt like exhausted. I've never done that before. It was really interesting. Seemed like 10 hours. They're like, no, it was only 6, Doc. It seemed like 10. It probably seemed like 20 for them dealing with me, right? But we did that. Now all the stretching protocols are on film. There'll be modules and lessons on the new website where you have a username and a password and you just dial it in. Anyways, God bless you guys. Grab some food if you want. Just save me a couple of pieces of chicken. Love you, appreciate you. And if you haven't been checked yet, I want you to line up right there by the front door right there. The front door. The back door, the second white door. And we're going to bless you and get you checked right now. God bless you. Have a great night.
But the voice of truth tells me a different story. I will choose to listen and believe the voice.